Here is your African news update. Africa-wide. Africa is only 11% vaccinated, and COVID has practically disappeared, leaving scientists baffled. Since the start of the pandemic, the continent's capacity to manage COVID-19 cases has come as a shock to many. Almost 2 years after Africa identified its first case of COVID-19, the World Health Organization finds that the continent is on track to completely control the virus. Over the last 2 years, the continent has witnessed 4 waves of COVID-19, each with higher peaks or more total new cases than the previous ones. The surges have been mostly driven by new variants of the SARS-CoV-2 virus, which were highly transmissible, though not necessarily more fatal than prior waves. Each subsequent wave has triggered a response that has been more effective than the previous, with each surge shorter by 23% on average from the one before. While the first wave lasted about 29 weeks, the fourth wave was over in 6 weeks, or about a fifth of the time. Over the past 2 years, the African continent has gotten smarter, faster, and better at responding to each new surge in the COVID-19 cases. Despite all the odds faced by the continent, that included huge inequalities in access to vaccination, the continent has weathered the COVID-19 storm with resilience and determination. African governments were seen to have reacted faster than elsewhere to impose travel restrictions and close borders to minimize contagion at the onset of the virus. The continent also enacted social distancing and lockdown measures at an early stage in the epidemiology curve than many other continents. South Africa, for example, introduced an articulated response comprising 8 overlapping stages, including a strict lockdown and major economic mitigation measures amounting to approximately 10% of GDP to assist the affected population. The continent, which has a population of more than 1 billion, has only had 1.5 million cases compared to Europe, Asia, or the Americas. The continent also recorded far fewer casualties as compared to other continents. This data has left many, including scientists and medical professions, baffled due to the fact that Africa is only seen by the West as a hotbed for disease and infections, but this time Africa proved otherwise. As China is planning to lock down Beijing due to the resurgence of new COVID cases, Africa remains largely unaffected, and many experts are left at a loss of words. Thanks for watching. Please subscribe, follow, share, and like our video. It's the best of supporting us. And remember, Africa is watching.